Effective management of mental health conditions often involves various therapeutic approaches tailored to individual needs. This module explores the main treatment modalities used in mental health care, including psychotherapy, pharmacotherapy, and emerging intervention. It also covers how to choose appropriate therapies based on diagnosis, severity, and patient preference. By the end of this module, you will be able to understand the different types of psychotherapy and their applications, describe common classes of psychiatric medications and their uses, thus identify emerging and alternative treatment options, recognize the importance of a holistic, patient-centered approach, understand how to collaborate with mental health professionals to support treatment plans. Psychotherapy, often called talk therapy, is a treatment approach where individuals work with a trained therapist to explore their thoughts, emotions, and behaviors. The main goals are to help people understand themselves better, manage symptoms of mental health conditions, develop healthy coping strategies, and make positive changes in behavior and relationships. Common types of psychotherapy. There are several well-established types of psychotherapy, each with a unique approach. Cognitive behavioral therapy, CBT, focuses on identifying and changing negative thought patterns and behaviors. Dialectical behavior therapy, DBT, a form of CBT that helps with emotion regulation and is especially useful for individuals with intense emotional experiences. Psychodynamic therapy explores unconscious patterns and past experiences to understand present behavior. So, interpersonal therapy, IPT, addresses problems in relationships and social functioning. Group therapy involves a therapist leading a group of individuals with similar issues, offering shared support and insights. How psychotherapy helps. Psychotherapy is a key tool in mental health care. It helps individuals manage symptoms such as anxiety, depression, or trauma-related responses, build coping skills for stress, decision-making, or conflict resolution, change harmful behaviors, thought patterns, and improve emotional regulation. Ultimately, psychotherapy empowers individuals to lead healthier, more balanced lives, both mentally and emotionally. Pharmacotherapy. Pharmacotherapy involves the use of medications to help manage mental health conditions. These medications are often prescribed based on the type and severity of their disorder. Here are the main categories. Antidepressants, used to treat depression and anxiety. For example, SSRIs like fluoxetine. Antipsychotics help manage symptoms of disorders like schizophrenia or severe bipolar disorder. Mood stabilizers, often used for bipolar disorder to control mood swings. For example, lithium. Anxiolytics help reduce anxiety and panic symptoms. For example, benzodiazepines. Stimulants, commonly used for ADHD to improve focus and attention. For example, methylphenidate. Indications, common side effects, and monitoring. Each medication has specific indications, what it's used for, but also potential side effects. For example, antidepressants may cause nausea or sleep changes. Antipsychotics can lead to weight gain or movement issues. Mood stabilizers require regular blood tests to avoid toxicity. Monitoring is crucial. This means checking on side effects, making dosage adjustments, and ensuring the medication is working effectively without harm. Role of medication adherence in treatment success. It's very important to understand that medication adherence, taking meds as prescribed, is key to successful treatment. When people skip doses or stop without guidance, symptoms can return or worsen. Educating patients about why, when, and how to take their medication builds trust and improves long-term outcomes. Together with psychotherapy and support, pharmacotherapy plays a vital role in managing mental health effectively. Emerging and alternative treatments. In addition to traditional therapy and medications, there are other treatments, some newer, some alternative, that can be effective for certain individuals. Let's break these down. 1. Electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS. ECT involves delivering controlled electrical currents to the brain to trigger a brief seizure. It may sound intense, but it's a highly effective treatment for severe depression, especially when other treatments have failed. TMS uses magnetic fields to stimulate specific areas of the brain. It's non-invasive and is also used primarily for treatment-resistant depression. Both are considered emerging medical treatments with growing support for their safety and effectiveness when used appropriately. Mindfulness-based therapies, yoga, and complementary approaches. These approaches aim to treat the whole person, mind, and body. Mindfulness-based therapies like MBSR, mindfulness-based stress reduction, help individuals focus on the present moment, reducing stress and improving emotional regulation. Yoga and meditation can reduce anxiety and improve mood by combining movement, breathing, and mindfulness tools. Other complementary methods might include acupuncture, nutrition changes, or art and music therapy. These are often used alongside traditional treatments, not as replacements. The evidence base and considerations for alternative treatment. While some of these treatments show strong evidence, like mindfulness and TMS, others may still be under study. It's important to consider, is there scientific evidence supporting its use? Is it being used safely and ethically? Does it complement other treatments or interfere with them? It's essential to stay informed and open-minded, always looking at both the clinical evidence and the individual needs of each person. Holistic and patient-centered care. In mental health, we don't just treat symptoms, we care for the whole person. This approach is called holistic and patient-centered care, and it's central to effective, compassionate support, integrating physical, emotional, social, and spiritual aspects of health. Mental health doesn't exist in isolation. It's deeply connected to physical health, like sleep, nutrition, and chronic illness, emotional well-being. Managing feelings and stress, social factors such as relationships and community support spiritual needs for those who draw strength from faith or meaning. A holistic approach means addressing all these areas to support recovery and well-being. Each person is unique. Their beliefs, values, and cultural background affect how they experience mental health and what kinds of treatments they're open to. Patient-centered care involves listening, respecting preferences, and collaborating with the individual to create a plan that fits who they are, not just what diagnosis they have. Teaching individuals and their families about mental health, called psychoeducational, is key to long-term success. It helps reduce fear, improve coping skills, and encourages early intervention. Involving family with the patient's consent can create a stronger support system, leading to better outcomes and fewer relapses. Collaborating with mental health professionals. Mental health care is most effective when it's a team effort. Professionals from different disciplines work together to support individuals, each bringing unique skills and perspectives. Roles of psychiatrists, psychologists, social workers, and counselors. Psychiatrists are medical doctors who diagnose mental disorders and can prescribe medications. Psychologists often conduct psychological testing, provide therapy, and help clients understand their emotions and behaviors. Social workers offer case management, connect clients to resources, and support families through advocacy and counseling. Counselors or therapists provide direct talk therapy to help individuals manage life challenges and mental health symptoms. Each plays a different but complementary role in a person's care. Referral processes and interdisciplinary teamwork. Sometimes one professional can't provide all the care needed. That's where referrals come in. For example, a counselor might refer a client to a psychiatrist for medication. A doctor might refer someone to a psychologist for therapy. In interdisciplinary teams, professionals communicate and coordinate care, sharing insights to make treatment more holistic and effective. Legal and ethical considerations in treatment planning. Working together also means understanding boundaries. Respecting confidentiality is crucial. Professionals must get informed consent before sharing information. Treatment planning must follow ethical guidelines and legal regulations, ensuring the person's rights and safety are always protected. Effective collaboration ensures the person receives well-rounded, ethical, and effective care, drawing on the strengths of each team member. In summary, therapeutic approaches and treatment modalities form the cornerstone of effective mental health care. Understanding the variety of available options, their indications and limitations enables practitioners to support individuals in making informed decisions and achieving better outcomes. A holistic, collaborative, and patient-centered approach enhances treatment efficacy and quality of life.